So my name is Jania, right? I am a Viva Eve Villager. I am a New Yorker, but I lived in Arizona for a very long time. Moved back about 5 years ago, and I've been here ever since and just enjoying it.
So I would love if you can share your story, but I want to go way back. I know I heard it, but I was there first time. But if you can start, what brought you to the doctor originally? What were your symptoms? What made you go?
Right, so there was a bloating in my belly, and it was just uncomfortable to lay on my stomach. I was playing with my niece one day, and I sat her on my stomach, and I'm like, oh, why is this uncomfortable? This is weird. And then I would lay down flat, and it would be my belly would be here, and then it would be this concave thing.
Yeah.
And I'm like, what is that? That's a weird muscle, you know?
I had that before.
So I self-diagnosed myself, and then I went to my my doctor, and
This was in Arizona, right?
I was in Arizona, and she had been going through some things, I suppose, with her business because she opened her own practice. It's busy, and so she examined me, and then she called me, and she said, yeah, your path is abnormal. Let me see let me set you up for some scans. And of course, when you go get your scans, you're looking at the radiologist, so what did you see?
Yeah.
Is everything okay?
Yes.
And they can't say anything. They're just the doctor's gonna tell you. And so and you watch their face for a reaction, and there was nothing. And a couple weeks later, I get a call back saying, oh yeah, well, I sent your results to my friend, and he's gonna schedule your hysterectomy. And I said,
huh? It's
wait, what's going on? Oh yeah, you have a large uterine fibroid, so he'll schedule that. And I'm just wait, what? She's like, you'll have to talk to him about that. So that was the day she stopped being my doctor.
I remember.
So I go to this guy in Arizona, and he is rude and tells me, oh, well, yeah, so you're going to have to get a hysterectomy. And, if you were thinner, you would have seen the fibroid a lot sooner. And yes, and I'm crying. And he said, well, you don't have children yet? And I said, no. And he said, oh, I would have figured you would have had some children by now. And I'm like, dude.
And what you're saying is crazy, right? That there's people out there practicing like that, but it's even more crazy that your story, even so unique to you, so many people have been through this, which is insane to me.
And it's horrible. And it's really, it hurts, and it's horrible, and I'm bawling and I'm crying. And so I asked him well, what if I don't do anything? And he said, well, it'll just grow, but my partner and I are the best in Arizona. So, and I said, well, maybe I should get a second opinion. Well, we're the best, so you can get a second opinion if you want. And I just left in tears, hyperventilating on the phone with my dad, who doesn't know women issues, but he's trying to understand. He's like, well, call your aunts and call your mom and your sisters. And I'm just hyperventilating and crying. And I went to another physician, but by then I was, she, was cool, but I didn't get any feedback from her. I was already, he said, after he said, we're the best from Arizona, I said, well, fortunately, I'm from New York, and I'm going home. And, I left, and I came home, and I ignored it. So ladies, please don't ignore it.
How was your actual cycle at this time? I know you had the stomach, the bloating, but how was your period?
So when I got here in 2017, my cycle was normal. And that was the thing, some people have really heavy cycles and are bleeding really, really heavy. But for some reason, I didn't have those symptoms. I just had this swelling in my belly.
Yeah.
And so it was a couple years later, people would talk to me, but they would glance down at my belly while they're talking. And so that was uncomfortable. Even now when I'm talking to people, if they glance down, I'm still kind of insecure, are they looking at me? What's happening?
Janae, are you comfortable if I pull up that picture?
Sure. Oh, yeah.
Okay,
Please.
You have a before and after?
Oh.
Let me see.
Yes.
Let's see. It should be. Yeah, and it's very common. You know, your main complaints can just be bulk symptoms, like the mass effect, and you can have normal cycles, and that is still a reason enough to come in and get seen and talk about your symptoms. You know, sometimes people are like, my cycle's normal, like I'll just deal with this bloat, and no, that like we can do things. There's things out there for you, as you are hearing.
Absolutely. And so it's everybody's body is different, and it's really important to listen to your body. And listen to your family, because my family kept telling me, like, you know, get it done, do this. And I'm like, yeah, I'm okay.
Yeah, I'm
you know,
good.
because I was traumatized by the guy. You want to?
I'm not seeing it. It might be because you're in a live room.
Oh, okay.
But I just print out for your shoulder.
Oh, yeah, please. You can post them. It's fine.
But then, I guess, when you came back to New York, then how did you end up with us?
So I was working. So I think this started about 2.5 years ago, 3 years ago. So I was working, and it was the trifecta, right? It was the trifecta of pregnancy allegations. So it started with there was a guy I was very friendly with on the ferry, who operated the Staten Island ferry, because that's where I live.
Oh.
And one day he said, "Oh, hey, Jay, how you doing? I didn't know you were pregnant. Congratulations." And I said, "Harry, dude, I'm not pregnant, man." And he said, "Oh, well, you got to take care of that." And I said, "Thanks. I appreciate you." So I said, "Okay, all right. You know, just, you know, people are people. He's an older man. It's fine." And then I drive into
on your part. I'd be like, we're not friends anymore. I will not be taking this ferry.
Right. And you know, for those of you who have fibroids, you know, you understand, like, people accusing you of being pregnant. It's just like, I'm not pregnant, you know.
And I said before you came on that one of the symptoms too, a lot of people come in like, I look pregnant. I look almost 20 weeks pregnant, and you know, it's just because of the fibroids.
And that it happens to a lot of us.
So I'm sorry.
So there was I parked in the garage, and there was a parking guy, and he said, "Oh, mommy, I didn't know you were pregnant, you know, congratulations." And I was just like, "Thanks." And then the same day I was getting water, and we had a brand new cleaning lady, and she's very sweet. And I was wearing the wrong shirt. It was just the wrong shirt that day. And she walks over to me while I'm getting water and says, "Oh," and touches my belly. "Oh, I didn't know you were with child."
Oh no.
And I said, "I'm not."
No comment on women's bodies, please.
So I was livid, and then I leave the space, and I go in my office, and I close the door, and I'm just like, I'm not doing this. And so I start typing for support group, and Viva Eve popped up.
Okay.
Yeah. And then I met you, and oh my gosh, and you were amazing, and you cried with me, and you hugged me, and you told me that I had all the options, when this man told me I had no options, and you told me you have all the options.
You know, I remember our encounter vividly, and I remember your story like floored me. So I'm so happy that you found us, we met, and that we were able to get you the treatment and the help that you deserve. So how did you end up picking, because I'm not a surgeon, so I know you ended up with Dr. Sohan. How did you end up going? I know you were going in between the options. What made you pick the myomectomy?
So, you know, some of the procedures were going to shrink the fibroid, the UFE.
Yeah.
We talked about the shrinkage, and the shrinkage was going to be minimal. It was going to be maybe, I think it was 25%, 50% if I was really lucky.
Based on your fibroid, right? I mean, do you remember how large it was?
My fibroid was 27 centimeters.
Yeah. So with larger fibroids, of course, the embolization is to shrink, but your complaint is that bulk mass feeling. So to really get that handled, the myomectomy is the route you kind of.
Yeah, and it was really important too, because my period started to expand out to shrink down to they were coming every 10 days. It was coming every 10 to 12 days.
Yeah.
So it got really bad. So, you know, Dr. Sohan, who is
awesome.
Superman, he is my Superman. He, you know, said, "Listen, I'm gonna take care of you. You know, I'm gonna make sure that I take care of you. I can't make you any promises." I have a video on YouTube where I didn't sleep the night before my surgery.
Yeah, so tell me about that. Like, do you have to do any like pre-op before? Like, what did you have to do? How did you?
I didn't sleep. I've never been in surgery, like major surgery, ever in my lifetime, and so the idea of getting cut open was just mind-numbing to me. He informed me. He said, "Listen, this is not going to be a pretty procedure. It's not TV. this is going to be messy, and it's
actually what the myomectomy really is we're entering the uterus and we're surgically removing those fibroids, and we're trying to get as many as we can safely as we can. And like you're saying, nothing's 100%, right? But once we go in, we're able to know for sure what we can do. But it's really removing those fibroids as opposed to shrinking or medication or anything of that nature. So how was actual surgery day?
So surgery day, I woke up at like 3:30 or 4 in the morning, and I just start recording myself, and I'm like speaking a mile a minute, and I'm like, I don't know what's happening. and we get to the hospital, and his team of nurses, big up to those ladies, because they were hilarious and friendly and encouraging and warm, and the phlebotomist was very serious, but she was very funny too. So it was nice to be surrounded by people who had a lot of humor, because I think,
you need it.
I think that, with, that situation, you're anxious and you're scared, and, not being able to even just do your normal, like I took a shower, but I couldn't put on deodorant, and, I had to take off my nails, and, no lotion, and it's just like, but I'm a Black woman, I'm gonna be ashy. I don't want to be ashy for my surgery. So, but
you feel like yourself, of course. Humor. So how was the recovery? Because we typically say recovery time's like 6 to 8 weeks. Do you feel like it took you that whole time, or how was it?
I think that I was really, one, he was amazing. When you have a fibroid that large, usually, there's only one option. There's like that vertical, cut option, that line straight down your belly. And I begged and begged and begged him for one of the, bikini line cuts, and I begged him, and he said, I'm going to see what I can do, but I can't make any promises. And got it.
Oh, amazing.
So, it was great. So recovery was tough. It was tough the first couple days.
Okay.
So maybe like the first 5 days, and the recovery, it was strange, because day 2 I was up and walking.
That's amazing. Great.
Day 2 I was, still in the hospital, but I was able to walk up and down the hallway.
Were you able to stop thing like you were perfect?
I was on painkillers, so so pain was managed. Pain was managed, but I was able to walk around and get home, and I was mobile. I was slower than normal, because if you can't tell, I move at a very fast pace. But so it did affect my mobility, but it wasn't debilitating where I couldn't move.
You were able to get
and I think that that's our worst fears, with that surgery. It's like, oh my God, am I going to be able to
stuck in bed, not doing anything?
Yeah, and so I will say, for those getting surgery, getting up is a real thing. Like the process of sitting up is a real thing, because your muscles aren't there right now. they got fused back together. So you got to do kind of like a roll.
You need all the help you can get in the first couple of days.
Yeah, so having a support system around me, I had my family very close by. I had my boyfriend very, very close by, very supportive, helping me up, sitting me down.
Like you got back to your new self, back to your old self,
I would say maybe 10 days, not even 10 days.
That's awesome.
I think 10 days, that's when the walking, because I would go on walks, but there was a burning sensation. And then the itching, that's not itching on the top, it's like itching underneath, which is weird.
It's like you're separating and kind of stretching, and Yeah.
Yeah. So I think day 10, I was able to kind of like get up, walk around, lay down, you know, and do all those things. And that was amazing to me because it wasn't,
No, that's fantastic.
it wasn't long. It wasn't long.
Now, how are you sitting? How are you feeling now?
Listen, life on the other side.
Great.
Listen, life on the other side is amazing. Oh, you want me to show
get
you?
that before
Okay.
answer.
So Catherine, she printed the pictures that I sent her. So I'm going to show you the pictures. Okay, are you ready? This is my before and after.
Oh my gosh! Wait, you look so good. I mean, you look great before too, but like that is wild.
Nuts. And
how long before those photos?
So this one was
I can't see it.
April 13th, and this one is April 22nd.
That's insane.
You don't want me to show that one? There was a picture of my fibroids, and I was like, I have that picture on my YouTube site. So
did he exactly let you see the fibroid come out? Did they show you when it?
Oh yeah.
Can we show that? I don't think it's too graphic.
There's a disclaimer.
Okay,
disclaimer
so
that it is.
Yes, so please be warned. This is very graphic. So shut your eyes if you don't. Please do the disclaimer.
Disclaimer: close your eyes if you do not want to see what a real fibroid actually looks like. But I think it's going to be really educational.
Or blood.
Or
blood.
I'll tell you when you can open your eyes again.
Okay. Well, yes, we will tell you when you can open your eyes again. Ready? Yeah. 1, 2, and 3.
Oh my good. Wait, it's a one. Oh my god.
So I named my fibroids Schmitty. That was the name of my fibroid. And this is Schmitty and the gang had about 9 fibroids in this sack here.
And just for like reference, like look at Dr. Sohan's finger, like his hand compared to it, you know?
Yeah.
Wild. Oh,
yeah.
Oh my gosh, I'm so happy for you.
Thank you.
Okay, you can open your eyes again.
Yes.
Oh, that's great. I'm so happy that you are doing so well. I mean, you've come a long way. It's been many years of this. So, I mean, you deserve it. So I'm happy for you.
It's an amazing thing, life on the other side of fibroids.
Yeah.
You know, because there are so many things that I was holding myself back from that I didn't realize I was holding myself back from.
Like what?
You know, just putting myself out there. I started my own business. I published my first children's book, you know.
What's the name? Let's advertise.
Yes, so it's like, so those things, you know, have like really, you know, having Schmitty gone has really opened me up to be able to, you know, do a lot more. Christina, who is the admin here, if you meet her, she's amazing.
I love her.
You know, those are my ladies, those are my fam. Jessica and Christina, my initial fam here.
Christina,
and
awesome.
Christina asked me a question. I said, it seems like, you know, now I have no excuse to do things now. And she said, the question to start asking yourself is, what can't you do? Because there's literally nothing you can't do. And I'm just like, oh my God,
I'm gonna do it all.
Exactly.
It's on the world now, because you think about it, it was taking up so many of your days. Your symptoms were just holding you down, and now that's gone. So it's like kind of like you could spread your wings and really like be your true self. So I'm so happy for you.
Yes, periods are back to normal. It took some months for that to kind of normalize. But periods are back to normal. It kind of freaks me out because I'm just like, it's been 20 days. What's happening? It's like, oh no, you get a whole cycle. So it's just been a really, really wonderful experience. I can run without having a mass in front of me. I didn't even realize in pictures I was walking differently and standing differently. So I was standing back and I was walking back. Wow. And I didn't realize that I was trying to carry that 8 pounds because the fibroid was also 8 pounds. So it was literally the size of a big baby.
Yeah.
A large child.
was 9 pounds, so that's basically where you're at. That's wild.
Jania, just so we're getting a couple questions from the audience.
Oh yeah.
So one question that we got a bit ago was, what are the risks of treatment surgery and are there long-term effects?
What are the risks of like doing a myomectomy or?
Yes.
So I mean, bleeding, infection, you know, there is always a possibility that you're bleeding so much that you need a blood transfusion, things of that nature. And before any surgery, you'll meet with the surgeon and do a whole surgical consult, and you will go into more depth about hearing that. Yeah.
And if you're interested in pregnancy,
That was the next question.
yeah, if you're interested in pregnancy, you have to wait a full year.
Correct.
And
you need to
also
in the future. Yeah. So because your uterus is, I got the question that I'm answering, or?
Yeah, it was, can you still have kids after
myomectomy? Yeah, so you definitely can. And just like we were saying, you want to wait honestly a year to let your uterus heal, because if you think, like I said, your uterus is like my fifth now, there's an incision on it. We don't want that incision to open, and we would recommend a C-section. Not recommended, you do need a C-section. That's like where everywhere you go, you're gonna have to have a C-section, because you don't want that incision to open up as your uterus is cramping and going into labor. So you would have a scheduled C-section to prevent that.
Okay, and then if you were to get more fibroids or need to have it, would you have another myomectomy? And if so, would you reopen that previous scar?
So the scar thing I would refer to the surgeons about, but you can have a C-section. But again, repeat myomectomy. Sorry, but again, it is a major surgery. We are going into the uterus, so it's not a walk in the park, but it is an option. I have patients that had 2 myomectomies, but it is something that you definitely want to talk to with the surgeon, because say you have 2 myomectomies and then you want to have children, you want to have a C-section. Again, that's a state you're still going into that uterus. Is a risk of that uterus like opening up or rupturing. So we need to look at it.
I want to say this: the UFE procedure. Mm-hmm. So here's the thing: once you get one myomectomy, and you have a team, that you trust. Mm-hmm. Particularly like the people here. I don't know if there's going back to myomectomy. I'm not letting it go that long.
And exactly what you're saying. Like if you get a myomectomy and you want to have a child, do not wait. Like once you get into that year, like let's start going, because your uterus is free of those fibroids right now. There's no time like the present. Like let's get on it. That's what we usually say.
Yeah. Jania, someone asked if you could share your surgeon's name again.
His name is Dr. Sohan, Superman Sohan. He's just the most amazing person. How do you pronounce his first name? I never can get it right.
Mahindra.
Mahindra. Yeah, Mahindra Sohan. He's the Ghanaian doctor from Guyana. Yes. He's from Guyana. He's like the smoothest guy you're ever gonna see. He's just a smooth guy and very friendly, very personable, likes to laugh. To me, having medical professionals around me that, yes, take things very seriously, but also are willing to smile and laugh with me is critical, because that helps me trust you a little bit. So just make sure that whatever you need from the person to trust that person, then you find a person that you can trust.
Exactly. And we do, of course, Dr. Sohan is fantastic, but we also have Dr. Thornton here and Dr. Goa, who also do surgery. But they're all they awesome. And a lot of the times Dr. Thornton and Dr. Sohan are working hand in hand in the OR. So come in for a surgical consult with any of them. Be well taken care of.
A couple more questions. One was, do fibroids grow back after removal?
Say that one more time, I'm sorry.
Do fibroids grow back after removal?
So if you have one fibroid, the chance of them coming back is very low. But when you have more than one, the chance of them coming back is a little higher. We don't know exactly when. It could be years from now. It can be, next year. One of our old colleagues, she doesn't work with us anymore. She moved away, but she always said I could share her story. And she had a fibroid. It did not grow back until 10 years. Like she was well into menopause, and it was like very small. So it didn't bother her, But then I have patients years later, but they went and they, like I said, they didn't wait. They had their kids right away, So everybody's different. There's no black and white answer.
Yeah. I have had my exams. I do have one fibroid that's 1 centimeter.
Yeah.
Her name is Nona because no, nah. So,
I love that you
so,
named them.
yeah, like, no,
Yeah,
we're
and
not
that's
doing
common
this.
too. Like especially, you had several fibroids, so when we go in, we're targeting the large, like 1 centimeter. Sure, let's see what the deal is. And you may have that one little guy hanging out there, and years from now, hopefully it stays 1 centimeter. You go into menopause a long time from now, and it just shrivels up by itself.
It's been over a year since my surgery. I got it in April of last year, and I have a 1 centimeter fibroid that hasn't done anything. And I was devastated when I found out that she existed because I'm just like, what? But I was told like, listen, you had a very large situation going on,
Yeah.
so somebody tiny may have been hiding behind something. So
Exactly.
it's not doing anything. It's not affecting your health. And I said, okay, it's not affecting my health. I want to relax. I want to, just kind of breathe through this and know that everything is still available to me. So,
yeah. So 2 more questions that we see right now is, can you go back to just confirming, do you have to wait 1 year before trying to get pregnant after fibroid removal?
I strongly suggest waiting a year. Different people may, I'm not at our practice, but different people may say different things, but we really recommend waiting a year. You want your uterus to heal, I know you may want to try sooner, but you want to wait that year. You want to have your uterus fully healed. You want to have a healthy pregnancy, right? You don't want anything that we don't want to talk about happen, right?
Yeah.
So wait the year.
Okay. And the other question that we saw is, how small does a fibroid have to be to do the less invasive surgery?
So the laparoscopic myomectomy?
Correct. Yes, UFE.
That's what I think. Oh, UFE. So you said UFE? Or you said UFE, it doesn't matter, whatever size. You can do 1 centimeter, you can do 20 centimeters. That's fine. A laparoscopic myomectomy versus an open myomectomy, that's going to depend on the size and also the location, and you're going to really obviously need a surgical consult, and we're going to need to look at your uterus where they're placed, and the surgeon would decide based person by person.
Awesome. One person asked, is endometriosis the same thing?
So fibroids are non-cancerous tumors that grow inside or the outside of the uterus, we mentioned earlier, but endometriosis is when the endometrial lining is growing outside the uterus, and it can sometimes even grow further outside the uterus and attach to other organs. So 2 different things.
Yep. And I think if you have questions about either, definitely send us a DM or make an appointment, and we can definitely look into your own individual situation.
Awesome.
I think that's all the questions. Is there anything else coming up from the audience?
No. Okay.
Thank you so much for coming on and chatting with me and sharing your story. I hope that, everyone learned something from it and no one's suffering and come in and get treated. Be free like you.
Be free.
Yeah.
Be free.
One person just quickly asked, one more question is, how do you make a consult?
Okay.
So I think we have our info in the comments, right?
I think so. You can either send a DM to Viva Eve or just go to the Viva Eve website and give us a call.
Yes, perfect.
Yes.
It was lovely seeing you.
I missed you so much.
I'm so happy you're so great. I wish you all the best.
Thank you. And to all the ladies, just make sure you're taking care of yourself, okay? Make sure you're seeing your doctor. Don't ignore it. It is a serious thing. Never ignore it.
Yeah, and advocate for yourself.
Yes.
All right. Well, thank you, everybody. Appreciate it.
Bye, guys.